The incidence of a potentially deadly bacterial infection of the intestines called C. diff is on the rise. The FDA has approved a very promising new procedure for patients for whom traditional treatments have been unsuccessful. Gastroenterologist Dr. Homan Zadeh tells us about the dangers of the disease and the immediate results of this inventive new treatment.
There is a new and an innovative treatment for C. diff colitis. This is a disease that affects the colon. It's caused by a bacteria called Clostridium difficile. It causes severe abdominal pain, severe diarrhea, ulcerations, inflammations, irritation of the colon itself, weight loss, and it could be an ongoing disease. It could last for weeks to months. This is a serious disease. Up to about 20,000 people may actually die from this disease. And we do have a new and innovative treatment that could cure them up to about 98% of the time.
Dr. Zadeh discusses how this disease is typically treated and the newest advancement.
They receive our conventional treatment and therapy, which are antibiotics such as Flagyl or vancomycin or Difficile, and they haven't improved. So as a last resort, if patients fail at least 2 or 3 rounds of treatment, or they have relapsing of this disease, what we offer them is fecal transplant. The idea is that we're replenishing healthy bacteria in the colon and providing that balance that is healthy for all of us. We all have good bacteria, bad bacteria balance in our colons. And the patients who suffer from this disease have lost that balance.
Dr. Zadeh examines what can cause this disease.
This disease typically follows a course of antibiotic because of the imbalance that's created, and it is caused by Clostridium difficile, which kind of overtakes the colon, produces a toxin that creates all kinds of signs and symptoms, which could be quite devastating.
Dr. Zadeh discusses how the procedure is performed.
When one is infected with C. diff colitis, this new form of treatment that we're offering replenishes the colon with healthy flora. We obtain this healthy flora from donated stool. These are people who are completely healthy. They've been tested for all kinds of infectious diseases, and we're sure that there's nothing that could be transmitted to the recipient. We do this procedure literally by performing a colonoscopy, going as far as we can into the colon and getting up to the small intestine, and then depositing this material into the colon itself. By the next day or a day after, their diarrhea has ceased. They're having formed stools, and their whole general condition just has improved 100%. As days go on, they tell you that I've never felt this way for the past week or 2 or 3 months when I had this disease. So it's literally a game changer in this field of medicine, where people are not responding to conventional antibiotics or having this relapsing disease, and they're desperate. And this form of treatment and therapy really offers them a great hope.